This podcast is co-created and co-produced by Food Allergy Institute and the 12 Company. Listeners should know that the podcast host, Lesley-Anne Stone, is not a physician nor a licensed medical professional, and the purpose of this podcast is strictly limited to storytelling. Any content shared within the podcast is not intended to be medical advice and should not be used for diagnosis or treatment purposes. All listeners are urged to consult their healthcare providers. The creators, hosts, and guests of this podcast are not liable for any decisions or actions taken by any persons who claim to rely upon the content of this podcast.
There's one word that differentiates us, the Tolerance Induction Program, from anything else that's out there. And the one word is avoidance. When Sam got diagnosed with food anaphylaxis, you were told to live a life of avoidance, right? So you either want to live a life of avoidance or you want to be like Sam and live a life of remission, right? Of freedom.
Hi, I'm Lesley-Anne Stone, and this is Resilience and Hope, a Food Allergy Podcast. Thank you so much for joining us today. I have the most special guest on the planet with us, my hero, Dr. Inderpal Randhawa. Welcome to the show.
Thank you. Always the best introductions come from you.
Oh, gosh, I love you so much. It truly means everything to me that you're sitting down with me today. And I can't thank you enough for everything that you've done for Sam, for my family. You've changed the course of all of our lives. You've helped people from all over the world. You are an incredible person. I will go into your background for our listeners and our viewers, but you were a 5-time board certified physician. You are the founder and CEO of the Food Allergy Institute, which is the home of the famous Tolerance Induction Program, TIP.
Tip.
You are the founder and CEO of TPERC, which stands for the Translational Pulmonary Immunology Research Center. And it is a nonprofit that supports rare diseases, finding better treatment, and ultimately cures for rare diseases. And some of those rare diseases, including cystic fibrosis, I just want to say is also very, very dear to my heart. I lost a roommate to cystic fibrosis, and the strides that you have made is remarkable. You are a technology enthusiast, and we'll go into that in a second. You are a research scientist, a medical researcher. Yep. You are affiliated with numerous hospitals and universities and schools. You are the owner of Randhawa Ranch, and you are a father of 3 gorgeous, wonderful children, and you are a husband to a beautiful, phenomenal woman. Your wife is lovely. I've had the pleasure of getting to know her, and your family is just awesome. And you are the one and only Dr. Randhawa. I hope I didn't leave anything off, but I could go on. It's like that beer commercial. You are the most interesting man on the planet.
Oh, thank you. Yeah, you are way too kind. And I just want to say that I've been watching all your episodes, and I think you're doing a great thing for the food allergy community. Seriously. I mean, your story is the story of millions of people, and they don't have a way to get that message out there, and they don't have that feedback loop coming back to them, right? So, I mean, it's an important thing that we get this kind of message to the people, because especially now, I find that with all the digital age, we have lost that kind of sense of community, especially with disease-based communities. 20 years ago, totally different story, lots of get-togethers, but now it's all kind of stopped. So what you're doing here is huge.
Thank you. Thank you for the opportunity. It means everything to me. Everything. Thank you. So let's start in. The questions that I'm going to ask you today actually came from our listeners and a lot of the feedback that we've received.
Perfect.
Let's dive right in.
Yep.
FAI, the Food Allergy Institute, how did you start it? How did you develop the Tolerance Induction Program? What's your origin story?
I mean, it's a long story. I've been doing this work for over 20 years. And I think at a basic level, when I always tell people, 25 years ago, when I graduated medical school, it was not on my checklist or to-do list to build a large nonprofit research translational enterprise. It was not on my to-do list to build an institute that would actually take a disease and get it as close to a cure as we can possibly get and potentially hit that cure here in the near future. it was never on my to-do list to understand the world of healthcare through a business lens and figure out how you can actually do these things successfully, get out to the people and really scale, right? It was never on that. It was never that way. But I was always very aware of what patients went through and how untimely things were in medicine, right? So to me, the word is untimely, because I'd go in hospitals, and I trained at Northwestern, great school, great medical system. And I was always amazed because you had these very, very smart physicians and smart scientists who were hanging out on this side of the campus and these very, very sick patients on that side of the campus. And I always thought, man, how untimely, because these guys have some ideas, maybe they could work, but these patients don't have time. And all too often they never got treatment and they never got to see life, right? So that was always in my mind. And I found that I was alone in that sentiment. I was, I talked to my colleagues, they were just, yeah, whatever, not into it. They were trying to turn off the human story that is so critical in medicine and healthcare. And then, in my third year of medical school, my dad, who never smoked, never drank a day in his life and so forth, had a massive heart attack after four negative stress tests, and died like that. So I had to go through a big life change. And I often find that young trauma, when you go through that kind of young trauma, it does something to you, right? And it just wakes you up and motivates you. And that got me moving. And so when I went through training and started looking at things, I never forgot that early kind of interaction with the human story. And I said, especially as I got into further training, that there had to be a better way to do things. And you're talking to a guy who was heavy in the world of ICU and transplant medicine, right? So I was used to dealing with the sickest of the sick people. We did a lot of great things. We had a lot of good stories, but we also lost a lot of people, right? And I was like, this can't be the best way to do this. The one thing I loved about transplant medicine is we always went in with a huge amount of information. You would never just do a transplant, right? You had to literally gather hundreds and hundreds of markers and be like, this needs to match this. This needs to work well with this immune system. How do we modify things? But it took so much time and energy to get that data, right? And so ultimately, when I finally got in the world of food allergy, which was, right around 2005, I was really surprised at how devastating the diagnosis could be. I mean, just totally healthy, normal day. And now the world has changed because someone just lost their kid. And I was also amazed at how quickly the disease would progress. I mean, it was shocking. Like, someone could go from having a totally normal airway to airway closed in like 4 to 5 minutes.
It is shocking. And
no other disease does that. Think about it, right? Literally nothing does that. I looked at all that and said, all right, there's got to be a solution towards this. And I just kind of put my head down and started going. And, first thing I started off with was, if I can do this with an organ, why can I not do this with other proteins that are found in food? And I started studying botany and I started studying, plant biology, stuff that I'd never been trained on, and said, all right, let's see what's out there and let's see what kind of data is there. I started working with other scientists and said, let's start really delving into the realm of what an allergen is and can we understand these things? And ultimately, there was something there that we had to learn that we could test against, right? Otherwise, if I know it's there, how does the human immune system really respond to it? And I started getting into the world of diagnostics. Like, all right, how do we create a blood test to measure against that protein on and on? That helped a lot because that got me into the world of commercialization. Like I could actually understand like, hey, we can run this test across 1,000 people and see some really good results. What if we ran it across 5,000 people? We get even different results. So why is all that important? Because this allowed me to build large amounts of data, right? So I had data on the plant protein side. We did the same thing on the animal protein side. We then did the exact same thing on the human immune system side. Once I had all that data, I was ready to go because now I said, all right, I can now test people and I have proteins. Now the question is, can I use these proteins to change the way this immune system acts? And like I always tell people, I still remember the first time I got a set of data back on a patient that actually went through the earliest form of TIP. And I mean, my nurse back then, her name was Brandy. And I didn't fall out of my chair. I basically like almost pushed her out of her chair because I was like, what the heck just happened? Look at these numbers. This person's peanut numbers dropped 70% and we never gave them peanut ever.
It was the other proteins.
Right. And that it was the biosimilar model. Right. And so I said, okay, there's something here. So we
Huh.
tried it in many different ways, did a lot more database building, did a lot more research in the laboratory. And ultimately, within a matter of a year and a half, 2 years, it's like, all right, this will work at least on 100 patients. Will it work on 1,000? And will it work on 10,000? Will it work on 20,000? And that's where FAI began, right? It was really this idea of, can we utilize this combination of great research and data science to actually achieve what looked like clinical remission? Fast forward 20 years, and we are it. We are the global leader in this space. We are the best at diagnosing. We're the best at forecasting treatment. We're best at getting patients to remission and keeping them in remission for a lifetime.
And Sam is proof. We're approaching 7 years of remission.
He's not going back.
Oh, no, he is not. So Tolerance Induction Program, TIP, TIP, versus every other program out there. Because I hear this.
Yep.
I have friends and colleagues. Oh, my kid has a food allergy. We're doing allergy shots. Oh, my kid was diagnosed. We're doing this program at such and such university.
Yep.
And when I Google it, it's allergy shots. It's something called OIT, oral immunotherapy.
Yep.
What is the difference between TIP versus everything else out there? All the other headlines we hear about trials and research and all of these flashy headlines.
Yep.
What makes the Food Allergy Institute different?
There's one word that differentiates us, the Tolerance Induction Program, from anything else that's out there. And the one word is avoidance, right? Think about that. The word is avoidance. When Sam got diagnosed with food anaphylaxis, you were told to live a life of avoidance, right? Let's say you go through oral immunotherapy. You go through a year and a half of 2 years of treatment. Maybe if you're lucky, you can consume a half a peanut to a couple of peanuts. You still must live a life of avoidance. 100%. That person cannot do anything else. They still likely have other food allergies, by the way, and they still cannot live a life other than avoidance. If you go on Xolair, which is an injectable, right, which is FDA approved, those individuals as well have to avoid everything. The patch is also absolutely, you must avoid everything. So you either want to live a life of avoidance or you want to be like Sam and live a life of remission, right, of freedom. Because Sam was anaphylactic to peanuts at a very high level, and he eats 60 peanuts without a problem.
He ate 60 peanuts yesterday.
He can have, and that's 60 peanuts. That's an ungodly amount of peanuts, by the way, right? But the fact is, this program can prove that our endpoint is remission. You can consume a large dose of peanuts intermittently with never a symptom. And importantly, we can drive that immune system deeper and deeper into remission, which is huge. So avoidance is the differentiating word. Anybody who's listening to this, ask your doctor, your allergist, give me a treatment that will get me to a point where there's no more avoidance. And it all leads you down one road, and it ends at TIP. When you're done with the program, we're treating all foods. We're doing it at low risk, very, very low side effect profile. And at the end of the program, you are consuming way more than anything bite-proof. You're consuming large servings that guarantee you freedom. They guarantee you remission. I think when people eventually get into this program, they quickly realize, I'm signing a lot of forms. What are these forms? Consent forms, regulatory forms. We take that seriously. We are tracking your data throughout the whole program. We're giving a forecasted plan that we hold ourselves accountable to, right? We're doing this to build not only the regulatory strength, but the actual trust with our patients to say, look, we got your back. We have one job, and that's to get your kid to remission. We're not going to stop, and let's go.
Okay, so there's a lot to unpack here. So let's talk about your success rate. Because you talk about other therapies and success rates and transparency. What is the success rate of the Tolerance Induction Program?
So you have to look at our success rate based on our numbers, right? So take 1,000 patients who enter TIP. We have, around 100 to 150 people starting TIP every single month. That's a big number in the food allergy space. From
all over the world.
Literally all over the world.
Coming to Long Beach.
Coming to Southern California. And remember, unlike OIT, they're coming here every 12 to 14 weeks if you're international. They're coming here every 8 to 10 weeks if you're kind of local or in the US.
Mm-hmm.
And there is a way to do this program fundamentally at home safely. That's another big differentiator, right? You're not coming in for these shots or, these OIT visits. This is done very, very differently. So our approach here, let's take again 1,000 patients, right, who start the program. Of the 1,000 patients, 82 to 83% of them will go start to finish with zero symptoms, like nothing.
Like Sam.
Yep, like literally never report a single symptom. That's a great number. We'd love to get it even higher. Okay, so the remaining 18% will have one symptom in the entire treatment plan, which is roughly 2 to 2.5 years. One symptom, which is often just an itchy mouth or something mild, right? So self-resolves or, takes very little medication. Less than 1% of patients will have a more significant reaction, right? So that could be, an actual allergic reaction, so maybe some stomach aches with some hives, some wheezing, things of that nature. For this very small number of patients, we have a 24/7 command center, really literally on every single day, every minute. You'll have a doctor on the line. We're going to get you right through that, immediate symptoms that you're having. And key, we will get you right back on track, typically within 24, 48 hours. So we're not losing time. We're kind of keeping up the momentum of the immune system, which is really, really, I think, the goal. So you take those 1,000 patients, that's the spread of them, right? Generally very, easy through the process, very small chance that something's off, but we'll get you right back on track. Of that group of people, how many of them actually finish on time, right? Because that's what we consider a success rate. The ones who finish on time right now is about 95%. 95%, when we tell you it's going to finish, let's say in 2 years, 2.5 years, 95% will finish in 2.5 years. The 5% who don't, often a lot of it is out of our hands.
Yes.
So, some travel issue popped up, somebody got, a parent got sick or a grandparent got sick. Like there's just factors in there, but we include that in the data. So 5% just, that's life. We have about, any given month, we have around 10 to 12 patients. Keep in mind, we have, 20 some odd thousand patients in the system historically. 10 to 12 patients who we call outliers. So they are struggling. There's something that their immune system is not working as well as we'd like to see in the Tolerance Induction Program. We don't give up on those cases. We will often work with those families. We'll find ways to organize things financially for them, do all the testing necessary, and find a way to get them to the finish line. So the answer to your question is we don't give up on anybody. Have we ever had a patient truly fail TIP? The answer is not yet. It has not happened, because as long as your immune system can adapt, we have the data science and the models to actually figure out how to get it to adapt. Sometimes it takes a very long time, right? I mean, those are the rare cases. But if the family and the child have the grit to get to the finish line, we are with them all the way. So that is kind of the overview of how we get things done. It's a reflection of my philosophy, which is, I believe that a life of avoidance is dangerous. And I believe a life of remission is much, much better, safer, healthier, and gives you the long-term success any parent wants for their kid.
And that, when I first sat down with you, when we first started the program, I said to you at the end, is there any chance this could not work for Sam? And you said to me, if the only way this would not work is you don't do what I say.
Yes.
And we followed the treatment plan that you gave to us to a T.
Yep.
And we never had a problem.
I remember that. I do. I remember you coming in with you had like a calendar kind of schedule. I admire what you did. I mean, you did not, I bet you didn't miss a single dose.
No.
And
it was our priority.
We don't ask families to be that adherent. Kudos to you, but
it's kind of how I do life. Everything is 100%.
It's a great thing, right? It's the more you stick to the program, the better the results. We see that all the time. The program has evolved since Sam was in it.
Yes.
It's gotten a lot easier, I think, in some ways. It's become a lot more tech heavy on the patient side, which is good. And, we're trying to make this as fun and just positive as possible, right? Because there's nothing like telling somebody at the beginning of the program, hey, I know you've lived your whole life being absolutely afraid of peanuts. And when you're done with this program, you truly can consume any amount of those peanuts or any other allergen like a non-allergic person. And I would ask them, do you think you can do that? And their answer at the start of the program is, oh, no way. I can't even fathom the concept. The cool thing is when they're done, just like Sam, about 2/3 of the patients really kind of get into it. They love it, and they start eating everything, and they go out and they almost de-identify themselves, which is really, really cool. The 1/3, they kind of don't want to let go of that, don't want to let go of their, kind of previous identity. But having done this for a long time, even those guys come around.
So let's talk about that for a second.
Yep.
That's the patient, the child. Let's talk about the parent.
Oh, yeah.
What do you see from the parents who graduate?
Yeah.
Do you find that, because you said to me early on, you said, promise me that when this is done and we remission, you have to go back to your old life, meaning before Sam was diagnosed, when you didn't read labels, when you didn't protect everything in the house, when you weren't so on it. And I did, because I do whatever you tell me to do in life in general. I do everything you say. So tell me about that.
So I look at this from a experience standpoint. So, kind of like your story, right? Sam was diagnosed very early. So the total number of years you had to live as a parent of an anaphylactic child was a couple of years. When those families get in this program and they, finish, their trauma is much less, right? Like it hasn't left that kind of stain on their mind of like, oh wow, this is, a horrible, horrible thing. They seem to get over it pretty quickly, to be honest with you. But then we have the families where, they've been living with a diagnosis of food anaphylaxis for 15 or 20 years. Those parents really struggle. It's really interesting. No matter what we do, like it's just,
they can't get out of that.
Yeah. They struggle getting. Now again, it's not like it's debilitating. Like they are absolutely aware, and it's certainly something that I think we should continue to study and try and make better.
Yeah, it's interesting. That nervousness, that's interesting to me. I understand the trauma and of going through that, but it's a lot to undo psychologically for the parent.
Yeah.
But I listen to you and we don't worry. So talk to me about parents out there, because I've met quite a few who say to me, well, I've researched the Food Allergy Institute and the Tolerance Induction Program, but there's not enough like publications out there. And Dr. Randhawa doesn't have all kinds of papers out there, and it's the FDA and la. What do you say to those people out there?
I say to those folks, listen, welcome to the cutting edge. When you're on the cutting edge of any sector, any industry, you are going to, really kind of rattle people. All right. I mean, those are the facts. You're talking to a guy who has, 5 boards and over 100 publications in many different areas, pulmonary immunology and beyond. When you do things that are so unique and different and advanced, again, what does that mean for what we've accomplished? We've used a lot of applied math and machine learning systems as we've conducted the science. That's not how science was conducted for the last 150 years, right? How was science conducted? Every kid knows this when they go to science class, right? You come up with a hypothesis, right? And so hypothesis-driven science worked really well in the 1920s, right? When you were trying to solve very big problems. If, for example, I needed to see if this antibiotic worked for a disease. Yeah, sure. You put 100 people or 1,000 people in this arm who have pneumonia and you give them an antibiotic, and same for the 1,000 people who do not receive the antibiotic, and you study the results. That worked well at the beginning of the dawn of human medicine, right? Mm-hmm. Well, now disease is very complicated. Look at autoimmune disease, cancer. I mean, it's so complex. And when you use standard hypothesis-driven science, which means that it's boiled down aggressively, you don't get a lot of results. And that means 90% of drugs never make it to market. Most devices don't make it to market because they don't meet these kind of rigor of what that scientific process is. So that's a very long explanation. But what we do is we use applied math to actually deal with the complexity of a disease, right? So unlike the old model where you put 1,000 people here and 1,000 people here, we use every patient as their own control. So it's 1-to-1, right? So I have a patient who's anaphylactic to peanuts and walnuts and, pecans and maybe a seed. We will then use their system with applied math to forecast how to use biosimilar proteins to turn down that response. What is our comparison? Our comparison is the end of the program. So we'll take the patient who has a value of 100 at the start of the program. The patient at the end of the program has a value of 2, completely conducted by immunotherapy, and proven that at the start of the program, they could not consume that food without a reaction. At the end of the program, they're consuming cups of it. That is the best type of science, right? And so for those who kind of question, is that the best type of science? My answer is you need to wake up, because when you're getting to that level of proof or that level of evidence, we don't see that in medicine, right? You don't see studies out there that show 95, 99% success rates, because it's done in this old model of science. So when you kind of take all that together, publications are many. We've published certainly somewhere in the high 20s now, right? So close to 30 publications. We've presented them at all the academy meetings, all the major institutions. In the last 20 years, it went from full rejection because it was so new to, by 2015, I'd say a lot of the academics were kind of like, okay, maybe they're onto something. And actually in the last few years, people are now trying to start to understand what we're doing, which is good, right? So I'm all about peer competition. Competition makes people better, right? And so I'm glad to see that kind of movement, which is a positive. As far as the FDA side goes, absolutely. I have tried now, keep in mind, we are regulated basically under the FDA for our function of what we do as far as TIP. So every patient signs forms. That is a regulatory mechanism. But I actually tried to get our AI system, at least a part of it, FDA approved for the last 10 years, since 2015. Despite incredible amounts of money and time, literally years when you go through the FDA process, they've never rejected us. They like what we do. And the success of it has actually been validated, and they appreciate that. The problem is the data that we're using, right? So when we draw blood or when we run certain tests, the vast majority of tests that are actually run in the United States are not FDA approved. They're not. So if you go to, a Quest Labs and run a certain type of test, the majority of those tests are not FDA approved. So the FDA right now says, if you are using data from assays that are not FDA approved, we cannot approve the actual structure or system or AI system that you are operating. Even though the success rate is phenomenal and all that, they're like, we're just not ready to do that. And that's the FDA's decision. I simply can't change that. So when they finally decide to make a change, we will be ready to roll.
Let's talk about technology, because you mentioned AI, you mentioned technology-driven company. I've seen, since Sam being a patient in 2016, so much development that your company has done with technology and AI, and how you integrate it just from the patient side and the clinical side. Yep. I can only imagine what's going on behind the scenes. So can you elaborate on that and share a little bit more how you're using cutting edge technology and
Absolutely.
AI?
I always try to step back and say, look how different we are. Forget about in the allergy space. How about in all of medicine, right? Think about where AI is being used right now in healthcare. Like, I'm talking super advanced companies like Google, right? What are they pushing as far as healthcare? They are trying to make, your check-in time at the doctor's office faster. I was like, okay, that's somewhat helpful, right? But it doesn't do a whole lot, right, for the patient. Right. They'll maybe use some AI to read an X-ray and things like that, which is pretty good, but still not widely adopted. Here, we're using technology and AI at the start of the process, throughout the process, into remission. So the AI is used to make a diagnosis. So it'll tell you what you're anaphylactic to, not only what you're anaphylactic to, how much protein of that food is going to trigger what level of reaction. That's really deep information, right? Yes. The AI will then also give you a treatment plan, like literally how the biosimilar model works and how many months you're going to be on treatment and how many challenges you're going to pass. Again, very accurate in getting that done right. So parents can actually go along and be like, oh, so this is what's next and that's what's next. Wouldn't you like to go to your doctor and be like, hey, my cholesterol is a little high. Can you tell me when it's going to be normal? No doctor can tell you anything, right? They'll say, I don't know, try this medicine. We'll check again in a year and we'll hope it gets better. That's not so reassuring. So our AI is then also used throughout treatment. So when patients are going through the program, Many times we have patients who are very high performers, like their immune system's really like
Responding
great. We actually then remove visits from their plan so they finish sooner. And the parents don't even know that, right? They're just kind of cruising along, but it's
hopping in real time.
Exactly.
Yeah.
And then vice versa. If we see something we don't like, the system will make arrangements accordingly, right? Maybe move visits around, change some dosing around. And most of the parents have no idea that it's happening, right? Which is really cool. So imagine having, a guardian angel out there looking at your health all the time, saying, we're going to make all these adjustments to your health and your medications and your life because it will give you the longevity and the health that you're looking for. And then, of course, there's deep remission, right? Going into remission, like in Sam's case, right? How do we continue to identify next steps? We're not going to stop, but the AI is going to keep feeding this set of knowledge and information. So, it's absolutely exciting because not only are we great at what we do, the technology is so advanced. I wish the rest of healthcare would kind of wake up and say, hey, start this process. And we don't have to get into all the reasons why it's not happening, but I sure hope it changes. It's important. I mean, we can extend the lives of so many people with so many diseases if the adoption of this model really, really took off.
It's fascinating. It's fascinating. What do you say to parents out there who find out more in depth about what I went through with Sam, which my understanding is is a pretty classic case of TIP. We were in it for about 2 years.
Yep.
Oh, that's so much daily work at home and to go to Long Beach. And I'm talking to people who are in the drive of Long Beach.
Yeah.
Oh, it's so much.
Yeah.
It's too much of a time commitment. It's too much of a financial commitment. I'm going to wait a year to see how the blood work comes out, and then we'll reevaluate. People who kick the can down the road.
Yeah.
What do you say to those families?
Well, I mean, I've had who knows how many, tens of thousands of conversations with parents just like that, right? Where they're trying to figure out, what do I do next, right? And remember, it's human nature, right? Human nature is such that we want to maintain control. That's what humans do particularly well, right? They're adaptive, they learn well, and they want to control things. Mm-hmm. When disease happens, your sense of control is really thrown out the window.
Yes.
You know this very well, right? And you're kind of like, okay, how do I get control back? And for many of these families, they get control back by isolating themselves, right? They get away from the rest of the world. They get away from all the social interactions that revolve around food. They get away from any sort of educational, school, sports, et cetera, that are going to potentially involve food. That does work for a period of time, right? Like you could theoretically, kind of isolate yourself away from food allergy risk. You can generally pull that off, I'd say roughly till age 5 or 6, kind of hitting kindergarten. But at that stage, you are now kind of handing off your kid to a school and a teacher, hoping they don't make mistakes. And let's say you make it through the next few years. You're then doing it again in middle school. You're then doing it again in high school. Then you're doing it again in college. Then you're doing it again in life, right? As a young person. And I will tell you, I have never met somebody who's never had an allergic reaction, and they're anaphylactic, who's never had an allergic reaction over like 10 years of time. I just never met them.
You're right.
They will all have one. Many will have multiple. And as you have those reactions, over time, they do get worse, right? They get more reactive. The immune system's memory is pretty deep. So I take all that information and I try and tell families, look, you are asking for control. That's essentially what you're asking for. What are you willing to trade off to get control back? And ultimate control is not being isolated in avoidance. Ultimate control is being able to get into remission and achieving a lifestyle of food freedom that allows you to essentially be like everybody else. That's the lowest risk. That's the easiest thing to do. It's maintainable. It's something we're going to do for a long time as far as deep remission. So what are you willing to do to get to that point? If it's cost, talk to our teams. We can figure it out. I don't think the cost is outrageous. I mean, and frankly, the cost of healthcare as a whole now has gone up, and we have not raised our prices in any significant fashion for years. The other way to look at it is scheduling. Is a schedule so difficult? I would argue that, reading labels in avoidance is not easy. You're going to be spending at least 4 to 5 hours a week just reading labels. The number of schedule adjustments you have to make for your life is going to take at least another 2 to 3 hours a week. So you're spending about 9 to 10 hours a week right now in a place of avoidance. This program does not take any more time than that. You're simply redirecting your efforts. You got to do some work in the morning, some work in the evening. We give a lot of that, to you in our gummies and in our products that we've built up. So I often find that people are initially overwhelmed, like, oh, these are a lot of changes to my life. And then within a few months of being in TIP, all of a sudden their life opens up, right? Because they've cleared a bunch of foods, they can try new things. Their child is now not afraid, right? It's a real change in the way they look at things. And so going back to your question, if a family is thinking about, TIP and going through this program and getting to food freedom, if they really care about the maximum time that their child can have living a life without these limits, yeah, it's time to start now.
I agree.
I mean, it's really that simple.
I tell people, just call and get the free consultation.
Yeah.
Then you have options. If you don't call, there's no option. They will answer all of your questions for your case, because your case is different than Sam's case and the kid after that and the kid after that, because it's precision medicine.
That's right.
The AI,
yep.
Your program, it spits out the plan. It's true. And we knew way back then how many visits we were going to need, approximately how much time this was going to take, all of that. And that was back in 2016. And here we are in 2025.
Yep,
and it's continuing to optimize and evolve. To me, it's a no-brainer. This is just crystal clear, the answer.
Yeah. I would say, look, families have a lot to process, right? And, they're nervous, totally understandable.
It's scary. It is scary.
Right. Exactly. So they need to take, the time they need, but they need to process information in a way that looks at trust, right? And regulation. I really believe in that. And I guarantee you, when they look at those two factors with us compared to anyone else, they will truly appreciate how this place has been built, because it will welcome them in. They will be able to answer any and all questions. They will also be able to look at information, that's in real time. And that is something you just don't get anywhere else.
We were in your clinic about a month ago for Sam's remission appointment, because we go every year because I want to feed the AI. And also, I obviously want to know how he's doing, but it's very important to me that we come every year for his blood work and we find out the next plan for the next year. But anyway, it was flooded with people in the weight room. It was popping, and I have not seen it. That kids all ages, and you could just tell people from all over. You could just tell who's from LA, who's not. Like, you could just tell. And I saw Herman in the lobby, and I said to him, I'm just curious, like, it's so busy here. And he said, this is split. He said it was a 60-40 out-of-towners versus people who can drive range to LA. And the majority of the patients here today, he said, are very complex cases with underlying health issues as well.
Oh, big
and that's
time.
something else I want to make sure we highlight, because I do hear that feedback too. Oh, my kid has EOE.
Oh, yeah.
My kid has some other issue. You don't turn those down. You welcome those.
Yeah, 100%.
You serve everybody. I want to make that clear.
Yeah. No, again, TIP is it's open, right? We don't have exclusion criteria. The only inclusion we have is you have to have anaphylaxis. Right. Right. So if you're not anaphylactic to food, obviously that's not our thing. But if you are anaphylactic to food and you happen to have asthma, you happen to have EOE, you happen to have severe eczema, you happen to have colitis, you happen to have some other inflammatory bowel disease. We have patients who've had kidney transplants, liver transplants. All the most complex you can imagine. We welcome them, right? And right now it's about 2/3 of our cases, right? So literally the vast majority of our cases are very complex.
Incredible.
And I applaud those parents, because, they truly have nowhere else to go. They've gone to the top institutions. They've gone to the big names you've all heard of, right? Only to be turned around and turned away. We welcome them. We've had equal success in their cases. We have a lot of support on our side to kind of make sure those cases do well, right? Remember, we're not a small company. A lot of people, I think, if they haven't been here, they don't realize the scale and the
300
scope.
employees.
Oh yeah, it's huge. 125,000 square feet of space. It is 2 locations, right? Like this is not a small enterprise, but this is all we do, right? This is like all we do every single day. We are very serious about our work.
So something we haven't talked about, referred to yet in this conversation, and I've gotten quite a few questions about, is SLIT. SLIT. Can you talk about what SLIT is?
SLIT is sublingual immunotherapy. So I want to be really clear on this. So when we talk about SLIT here, we're not talking about SLIT for food allergy, right? So we're not talking about SLIT for food proteins or things like that. We use SLIT here to address pollen allergies, right? And environmental allergies, right? So think of, cat, dog, horse, dust mites,
grass,
trees, all that stuff, right? And when I was early in my career, I saw that globally, Japan, Singapore, Europe, they used to use a lot of SLIT, like to treat these things. It was not done in a very clean way, but it was done. And I was like, wow, that's weird. Majority of the world is doing it this way. Mm-hmm. And here in the US, we use shots, allergy shots. Mm-hmm. A lot of people know what that is. And so I started questioning why they do it that way. Why do we do it this way? So around 2005 and 6, when I was learning about all these different proteins in the food world, I started identifying sequences that were actually found in environmental, protein. So for example, grass, and how that was actually extremely similar to a sequence that could be found in peanut as an example. And then I started using those types of assays, and I started using that kind of data build to answer that question. So in the end, what do? We basically built a machine learning system for environmental allergies. Right. So patients can go on SLIT, and not only will it help their food allergies for what we need it to do, it'll actually make you less congested, less itchy eyes, less asthma, less skin problems. And it's been very effective. Only about 40% of our patients are on it. It's not like for everybody, but for those who are on it, it's highly effective. So, I'm very proud of that additional program that we built. Like I tell people, I'm always loving the cases when people come in and they have like really bad skin, really bad asthma, bad, sinus, hay fever, and really bad food anaphylaxis. They finish TIP. Their skin's normal. Their lung functions, 100%. They have no itchy eyes or runny nose anymore, and they can eat all their foods. To me, that is like the whole story.
That was Sam.
That's Sam. Yeah.
Because we didn't realize that he had 13 environmental allergies until you diagnosed him with that. We just thought he was a toddler in preschool cough and just runny nose and the things that preschool kids get. But no, within 2 months of starting SLIT, all of that went away. The kid is really healthy. He rarely gets sick, and the SLIT works. But SLIT is, in layman's terms, a concoction of those allergens, and you spray it under the tongue. It's oral therapy.
You got it.
And it is a concoction designed specifically, again, precision medicine, just for the patient.
That's right.
So just for Sam.
Yep.
Every day.
And it's highly effective. I mean, we actually just published some of our work on SLIT. And interestingly, right, I mean, for something that's at least been around for like 60 years, there's not enough research on it, right? And again, I always go back to that point of, if something's so widely adopted, like how come they don't do more research on it? And, that's often because people stop asking questions. Right? They kind of be like, oh yeah, it always works. We think it kind of works. We don't know why, but we've built that, leading edge here. And with that, with the data, with the information, we publish that work. And again, we hope that kind of allows us to get out to more people.
I remember early on in the program, because we spent a lot of time with each other early on in the program. And I was telling you about my sister. She's highly allergic. She's to cats and dogs and pollen, and she had asthma, all kinds of environmental allergies. You said to me, tell her to go on SLIT. Find a doctor. She's in New Jersey. Find a doctor somewhere in her area who works with SLIT, who prescribes SLIT. So I told her, and she went on SLIT, and she can now be around cats, be around dogs. Her sister-in-law brings her dog over to her house. You don't understand. This would be like a death camp for my sister if a dog was in her house. It's unbelievable. And I was talking to her about it this week. I said, do you remember what you were like before SLIT? And she was on SLIT for 5 years.
Yeah.
And some people would say, oh, that's such a long time to take that every day and the expense of it. But for the rest of your life,
it's a game changer.
You're okay. And you can now go over to someone's house and not worry if they have cats or dogs. It's incredible. The
point that you're really bringing up here is, we like immune systems that are nice and stable and normal, right? And when your immune system's not happy, there's some bad consequences. If you have food allergies, your immune system's not happy, the consequences can be, deadly. If you have, an allergy to pollen or cats or dogs, your immune system's not happy. You might get a lot of bronchial infections, and that can have serious consequences. You might get a lot of sinus problems, and that can have serious consequences, right? So I think people all too often downplay allergies, which is, very frustrating to me. And we know they're tied to so many diseases and so much morbidity. It actually makes people sick. But, all too often it's still made fun of, by comedians, and, nobody takes it seriously in the movies. But again, we're here to change that.
So what is next for the Food Allergy Institute?
We are growing as fast as we can, as safely as we can, right? I mean, those are two, I think, important points. Keep in mind, again, we have hundreds of employees here. These are folks who have to be trained on our systems. They have to be, in so many ways, certified, right, to be FAI, whether it's a physician, a provider, a nurse, or any of our additional staff. It takes time to master that process, right? And I think we've done that. We've done a great job. And I, give kudos and credit to all of our teams here. We're next trying to find out what is the best way to expand, right? I mean, because it's not as simple as, our facilities here are very large. To just go open another facility somewhere is not easy. And this kind of struck me probably, I don't know, it was like 5 or 6 years ago, just pre-pandemic. I was on the East Coast in New Jersey, actually. And we basically had an event there, right? And it was just an introductory event to TIP and what we do. And I was pretty amazed. Like, people drove from upstate New York, from Kentucky, from Georgia, just to see a presentation for a couple of hours and interact. And I would ask them, like, okay, now that you know more, do you think you can fly out to California a few times a year? And, it was just something that was so difficult for folks, right? Just to be like, okay, how can I figure out how to take time off work? The travel can be costly sometimes, all that kind of stuff. So that's when it got in my mind about when we expand, the expansion needs to reflect the needs of people, right? So we need to be within some kind of driving distance for large numbers of people. We've seen that in Southern California. Obviously a big chunk of our patients come from here. Having some kind of proximity, even if it's like a 3-hour drive, better than hopping on a plane if we can make that work. So that's our model going forward. So, we are opening up a site in the San Francisco Bay Area, which is great. That's going to be for our local patients, call it within a few hours drive, to test this model. If that works well, we would kind of replicate that model a few more spots in the US over the next year. And, we're also going to continue that growth for a few more years throughout the US and potentially with some international locations. So we feel the pressure. I understand the burden that these families carry, and I understand how difficult it is to make that travel work. So, we hear you, and we will expand and get to you as quickly as we can.
It's so exciting. What is next for you? What else do you want to conquer next?
Yeah, that's always a great question. I'm an unusual guy. I understand that. I have a lot of interest in a lot of things, right? I mean, I really do want to try to push this model that has made TIP so successful. I want to push it across as many disease areas as possible, whether that's through TPERC, other collaboratives. I mean, we're there to do it, right? And I hope I'm the ambassador to get that word out there. It's not easy.
So
it's not easy, right? I mean, the classical medical establishment is so not ready for technology. And we know that. We've already seen that. But like I've said, it's coming, right? And either you are the doctor or scientist who knows how to use AI to benefit what you're trying to accomplish, or you're the doctor or scientist who's left behind. And, I don't want to see that happen, because I never question the intent of all these folks. They're trying to make things better, right? Let's do this the right way. And so I hope to kind of continue to push that, message across all these different areas. And then to be honest, I would like to see this work in TIP start to apply to other food-based diseases, and that includes the adult population. They've been left on the wayside, the last 20, 30 years. Those studies always kind of left adults out, right? Because they know they're harder to treat.
And is it because the immune system has developed, the gut system has developed, it's evolved too much?
It's a complicated answer, but I'd say it's generally because the immune system has aged, right? And so an aged immune system has a lot of fixed memory. right? And so to get an immune system to forget things is not easy. But we've put a lot of hard work in the last 20 years and treated about 300 adults. These are people in their 30s, 40s, and 50s, and collected that data. So we have the data set now, and the goal is in 2026 to actually kind of launch this adult tip program, which I think will be huge, and very excited about that.
Oh, that's huge. I know quite a few people.
Yeah. Oh yeah, no, they're already knocking on the door. But my goal is that, if we can do this successfully, it's going to have the same results: remission, food freedom, and so forth. But, we do have to, again, build this, not quite from scratch, but certainly build it up from an early stage and make sure it's safe and successful.
Why are food allergies so prevalent today? When I was a kid, nobody had food allergies.
Yeah.
Now, there's, what they say, 1 in 13 kids in the classroom. Is that the statistic?
It's
probably even more now.
It's very high. 2% of the U.S. population has a peanut allergy.
So why? Why is this happening?
No one has a 100% answer. I can only speak from my experience and all the vast amount of research I've done now for over 2 decades. We have to pay attention to what is driving immune systems to become upset, right? This is an immune system that is no longer acting normal. Keep in mind that most of the foods we eat, those plants and proteins, have been around way before humans ever evolved, right? So this is not a problem as much with those plants as our immune system.
Interesting.
And our immune system is upset. And, I believe that a big part of this is environmental activity. So that's like climate change, high pollen counts. It's driving the immune system to become much more allergic. That's not healthy, number one. Number two, we're also dealing with an immune system now that gets much more activated on a regular basis. Maybe that's viral infections. Maybe it's different types of bacteria that are, causing certain issues. But the level of that doesn't help. And thirdly, I'm a big believer in pathways that trigger inflammation. And this can have things to do with obesity, what you eat, how stressed you are. All those types of high inflammatory pathways combined with the first 2 points, it will definitely create a setup to develop more food allergies.
Thank you for being here. Thank you for today. I could go on all day. I could sit with you forever and ever and ever. I don't know if you want to sit with me, but I could sit with you. Thank you so much. Thank you for the opportunity for this podcast, for me to revisit some of those moments I had with Sam through the program and the people who helped us along the way, and to share our story. And thank you for everything you've given me and my son. And you are an extraordinary human. You are a blessing in my life. And I just adore you. Thank you so much. Thank you.
Well, thank you. And again, I really appreciate you taking the time to host this podcast. And more importantly, I appreciate you advocating not only for TIP, but advocating for all the millions out there, who do not have the voice that they should. And, again, I'd say just keep it going.
Thank you. And thank you to you, the listener. Thank you so much for joining us today and through these 12 episodes of Resilience and Hope, a Food Allergy Podcast. That is a wrap on season 1. And I am so grateful for this opportunity to have been on this journey with you. If you have any questions or comments, please follow us on social media or write to us. We have an email, resilienceandhopepodcast@gmail.com. Our Instagram handle is @resilienceandhopepodcast. Until next time, I'm Lesley-Anne Stone. Resilience and Hope Podcast, made possible thanks to the support of Food Allergy Institute.